Hello, good evening. I am Isha Thakur and I welcome you to Librate's YouTube channel for another live session. Today, in this session, we have the privilege to host Dr. Padmaja Lokireddy, a renowned hemato-oncologist with special interest in bone marrow transplant with many credentials in her field of expertise. She has been working as a consultant hematolo-oncology and bone marrow transplant at Apollo Hospital, Hyderabad. She has received many awards and recognitions, including Meritorious Award in the field of hematology and transplant by International Biographical Centre, Cambridge. Her name was also included in the International Biographic Dictionary, Cambridge, and recognized in the top 100 physicians for 2016. Before returning to India in 2015, she spent time at Johns Hopkins Cancer Hospital, USA, worked as bone marrow transplant consultant at Queen Elizabeth University Hospital, Glasgow, University Hospital, Birmingham, UK, Ipswich Hospital, which is a part of Cambridge, and University Hospital, Leicester in the UK. With all her expertise and experience, she is going to help us understand COVID vaccination. Is it appropriate for bone marrow transplant and leukemia patients? And also going to take all the related queries. Welcome, Dr. Padmaja, and thank you for taking out time for this session.
Thank you. A very good evening. Thank you for a great introduction, Isha.
Thank you, Doctor. So, to our viewers, as we all know, the world is going through an anxious time of pandemic. Things have changed in reference to our normal routine checkup with the doctors. This seems to be a more difficult period for the people who are already diagnosed with pre-existing conditions and who were aligned with their major operations. Patients suffering from leukemia or who are aligned with their bone marrow transplantation are facing multiple issues. With the looming fear of the contracting disease, COVID-19 vaccine is now available and patients are concerned about its pros and cons with its effects on their existing disease. Thus, to combat this fear and to answer critical questions, we need knowledge from medical experts like Dr. Padmaja Lokireddy. During the next few minutes, we will be asking a few questions to Dr. Padmaja. To our viewers, please do not hesitate to put your questions in the comment section and we will make them sure to include them so that Dr. Padmaja can answer them. So over to you, Doctor.
Thank you, Isha. So we're going to start talking about, I'm going to put some slides and we'll go through a common scenarios. Yes, we're going to have a COVID vaccine. We're going to go through who can take it, who should not take it, and how frequently, and what all about the vaccine. Before that, because of the second wave coming on, I think people still have to be vigilant about taking all the precautions to prevent any contracting these viral infections. So I'm going to give you a few scenarios. We're not going to say lockdown in your house. We're going to say how we tackle running a normal life in our day-to-day activities. And I have focused on few areas which patients would encounter in their visits or general. So we would look at that particular scenario and how do you handle it. At the end of it, I would want my viewers to look through each slide and score them how much they are doing. So if you're scoring over 80%, at the best, you've taken your precautions to prevent. So apart from the vaccine, let's go over. So just going to share my slides. We're just going to focus on general measures. So as I said, I'm going to look at the situations and what measures to take. This is a common thing patients during outpatients visit. A lot of people are waiting. They're waiting for blood tests, waiting for consultations. How do we cope that? So maintain a distance, 6 meters distance, what we call it. It's not practical in every hospital. So maintain the face mask, keep it on the mouth and nose, especially while talking, because many patients have got this habit. When they're speaking to the doctor, they put it down. When they're speaking to a new person, they want to show, it's a very common thing to have a social activity to have the face mask off. So try and resist it, try and speak louder. If you're not able to hear the other person, ask them to speak loud. Do not come too close. And use the hand sanitizers frequently. Do not touch your face and mouth. This is a very common thing. Avoid eating or eat alone. Don't eat in crowded places. And remove and wash all the clothes after you come back home, especially if you visited a very crowded place. And the next situation, I'm going to focus visiting a grocery shop or any other indoor shop. Please see what you're already doing and incorporate these measures if you've not been doing. So if it's an outdoor or online shopping, it's always preferred rather than indoor supermarkets which are closed areas. And go to a shop with less customers are there, or when the timings when there are less numbers will be there. If you're a person who is not working, try and choose the work days and less peak hours in the middle of the day. Not many people are going to the shop, so try and use that. Do not touch unnecessary items. Just have them, touch them when you're going to put it in your trolley. Stay in the shop as less time as possible. So you're in with a list, you're picking them, and you're out. Make a list prior to going. Pay by phone, like using Google Pay or any other UPI services. Buy your fruits and vegetables that can be washed or cooked prior to eating. So take all these precautions when you're doing the daily shopping. What do we take when we go to the restaurants? It's best not to go when we are having increase in numbers, but if you did want to go, you go to a places where they have an outdoor area to sit and there is a good space, and eat freshly cooked food. Avoid roadside stalls, especially where there is a higher turnover of people. Try and avoid them. Try and avoid the vendors, small vendors who are not wearing the mask, who are not taking the precautions. So they're taking it too easy. Wash your hands before eating. Make sure servers have their masks and do not come too close to you. So next thing is a family gathering. This is a common thing. We've waited for so many months and we can't continue to be isolated. We have to start having some socializing activities. But how do we do that in this time? Better to have a small gatherings of known people. Try and do it in your outdoor area, lawn, or some other areas, and make sure that anyone coming do not have any of the symptoms which could be contributing to COVID. So ask them they do not have a cold and cough or fevers, not unwell before, and make them outdoors. Always, always wear masks. If you are removing your mask, keep the distance. There are times you do not want to wear the mask when you have very close people come in home. So try and keep the distance. And especially while you're eating, keep that distance. Try not to touch or hug each other. And if you're speaking very loud, you should be outdoor. When you are speaking louder, there are more airborne spread. So maintain that distance, keep it outdoor, especially when you're eating. When your funerals are the most risky areas, recent times, whoever had in the second peak who came into the hospitals, most of them have attended a family gathering like marriages or the funerals. So just be aware of that. So the last thing is, how do we take measures to protect our elderly people, our vulnerable group at home? So when you're a person who is active, going to work and coming back every day, visiting lots of people, try and avoid touching them soon after you come from outside. Take shower and isolate yourself if you've come in contact with anybody. Avoid visitors at home. And if you've got anybody who is unwell at home, try and isolate them until the symptoms resolve. Avoid outside food. Limit traveling outside as much as possible. I know it's very difficult, but when you do go for it, try and take all the precautions what we've just discussed. So still the same things, keeping your mask, maintaining a social distancing, hand washing are all these very useful things to do. So the next question comes, are hospitals safe? What we have seen in COVID time is a lot of patients stopped coming to hospitals. And when the lockdown has eased off, people started relapsing with their leukemias and lymphomas. So try and keep the connection with the doctor by a different means. You don't have to come to hospital. There are ways you can do. Are hospitals safe? I would say in the hospitals, everybody is worried that you would get a COVID, so they do wear a mask. So nobody you would see inside the hospital not wearing a mask. So in a way, if you're outside, you have a false feeling that you are safe. So hospitals are relatively safe. No place is safer, so they are relatively safe. Avoid having waiting times in the gathering areas, and do sit in your car and come in when your appointment comes. Use the teleconsultations if you do not need a physical examination. If you're coming for your just a blood test, take a teleconsult and try and discuss with your doctor. Only if necessary, come to the hospital. Next, go on to the vaccine. We just spoke about how do we prevent, and these are all very common things, but I want you to check whether you're doing it or not. Anything you can adopt new. Coming back to the vaccine, at the moment in India, COVID vaccine is given to healthcare workers, but it's soon going to be rolled out. to a lot of other professionals. Now the police department has already had. It's going to come on to the schools and over 55 years, and it's going to be rolled on to a multiple other hospitals, not just the government hospitals. I think the good number of hospitals are going to be given this vaccine as per the recent news. So I think it's important to know for all the general public whether should we take the vaccine or not, because there has been a lot of concerns about a vaccine. All of us have completed taking the vaccine. We've completed a second dose as well, most of the healthcare professionals, and we hardly had seen any reaction. So we can say for definite after taking it, it is safe. Do not worry about it. So coming to the vaccine, it is not a live vaccine. It is a killed vaccine, so it is safe to take. Concern is that immunosuppression patients, like cancer patients or people who are taking a lot of medications, the response to the vaccine may be a little bit less. That means whether you are going to be completely protected or not, what we call as an efficacy may be slightly less than this regular population, but some response is better than nothing. I would urge all of you to think, yes, the response to your vaccine may not be that effective for you, but it's something better than nothing. It's not about having a reaction. It is not having a good response to your vaccine. That is the concern in immunocompromised patients. I want you to remember this. We have two vaccines available. That is, one is a Covishield, say by Serum Institute Pune made, and the other one is a Covaxin, which is a Bharat Biotech made. And all these vaccines are given intramuscular, that is into your muscle. It's hardly zero point 0.5 ml, so it's a very small dose. You hardly feel it. And most of our vaccine in India currently are all government sponsored. Next question comes, a lot of people say, how do I register for it? There are lots of, there is a government website, but I think the news is still naive. I would ask you to wait for this end of this month. We'll know more information how to register. Maybe in a small scale hospitals, it will become available. How do we, at what time do we take the vaccine? So if you're a patient who is on chemotherapy, the big question is, when do I take the vaccine? All of us know there are two doses for the vaccine. And when do we start it? If you are a patient who is a lymphoma patient who is on R-CHOP or bendamustine or RCVP, or if you are on a myeloma patient who are on bortezomib or Velcade, Borvis, so many other combinations, or a lenalidomide, you have to take the vaccine when your blood counts are maximally recovered. So that means before your next block of chemo, your counts would have completely recovered, or about 2 weeks after your chemotherapy, where your blood counts will start to recover. That is the time to take your vaccine. So the timing is when your blood counts, neutrophils are good, when your platelets are good. The cutoffs we see is platelets should be more than 50,000 and neutrophils more than 1,000. So this happens in any of these chemos within 2 weeks after your chemo or just prior to your next chemo. Please do. If you are a person who is on single monoclonal antibody, like rituximab maintenance, a lot of people are on, or like immune thrombocytopenia, ITP patients who are on rituximab can take the vaccine anytime. You just have to check your blood count, CBC, ensure that your platelets are good, white cells are good, especially the lymphocytes are the ones which tell you whether you're going to respond to the vaccine good or not. It doesn't tell you that you're going to have reactions. If you've got a good lymphocyte count, there is a good chance that it will work for you very nicely. If you're a person who is on a lot of steroids, generally the lymphocyte count is slightly low. So that means the response to your vaccine may not be that effective. So we need to ensure these two parameters are good. If you are a patient who is on imatinib maintenance or dasatinib for a myeloid leukemia, or you're on a ibrutinib for CLL or a mantle cell lymphoma, you can take this vaccine anytime as long as your blood count is normal. What time gap you have to take between these two vaccines? Ideally about 3 to 4 weeks, but second dose can be taken within 12 weeks according to the clinical trials. But most of the times this duration is decided by your doctor, or the Department of Health have already given us the scheduled date. So we are not choosing the date, but as long as you are given the second dose within 3 months, it is still effective. Patients on chemotherapy may not mount a very good response to the vaccine. So sometimes if you're on a very high dose steroid, we know that your vaccine may not be effective. So you want to make sure all your close contacts, like your wife or children, whoever is there at home, they all have to be vaccinated and maintain the social distance. So they're not getting the COVID virus and then coming back home. So they should be vaccinated if you can't have the vaccine. How well the vaccine works in me, each person will have a different response. Now, a lot of people had a vaccine, and some people, we don't suggest you to go and check your antibody levels, but some have done, and people come back to me and say that I've got an excellent response, my wife hasn't got, or somebody doesn't have. It all varies. Our human body is so different. There is no recommendation that you should go and check for your vaccine antibodies. So, in a clinical trial, what we found is the efficacy, the vaccine antibodies after the vaccine is from 60% to 80%. It's variable from person to person. So, there is no recommendation to go and check. If you've taken the vaccine, there is a 60% to 70% chance that it would work for you. But if you don't take it, the effect is zero. You may have some innate response. So in patients with a cancer, it is slightly less potent than the other population. If I had a COVID infection in the past, can I take the vaccine? This is a very common question. Yes, you should take it because this could be a different vaccine. So you can prevent a reinfection from a new strain. So you should take it. When do I take the COVID vaccine? After you've had an infection, that is 3 months after the positive test, you should take the vaccine. And can these antibodies from the previous infection prevent a second infection? It is not definite because people have had a second infections and that antibody may not be sufficient to protect you. So you should always take all the protective measures. How about transplant patients? We just spoke about a COVID vaccine role in lymphoma patients, and we spoke about in myeloma patients who are on rituximab maintenance, or in chronic myeloid leukemia on imatinib maintenance. How about in bone marrow transplant patients? So any vaccine for a transplant patient, we say 6 months after the bone marrow transplant is completed, we would start a standard vaccination program. If you are a transplant patient, you may be well aware that we would have given you H influenza vaccine, that is a common viral vaccine, and a pneumococcal vaccine, meningococcal vaccine. And we also go back to your standard DPT, all your childhood vaccines, whatever you had, we tend to repeat that. So that's exactly the time scale. About 6 months after your transplant, we would want you to have your vaccine. And the priority goes to the COVID vaccine now. We could push back all other vaccines to the backup, and we want to keep about 2 to 3 weeks gap between the rest of the vaccines. And initiate the vaccine program 6 months after the transplant. If you are a transplant patient, if you've had a graft versus host disease, if it's minimal, you could still have the vaccine. But if it's a severe graft versus host disease, we would avoid giving you the vaccine. So the next question comes, who should not take a vaccine? As if you are having a severe graft versus host disease, like grade 3 and 4, you may be on a high dose steroid, you should not take the vaccine. Or if you've had a ATG treatment, anti-thymocyte globulin treatment is given for patients with aplastic anemia or during the conditioning of transplant. So these patients should not take the vaccine. And definitely pregnant ladies who are breastfeeding, children, these vaccine safety has not been established in the trials. So we would say we would not give it to these patients because we've not tested in them. There is no information available in the guidance of the vaccination in patients on maintenance therapy, like post transplant, post CML transplant, or post PH positive ALL. We would give imatinib maintenance. But in those, there is no data. But a lot of people starting to believe that if their blood counts are good, their lymphocytes are good, and they're 6 months to 8 months out of the transplant, they could have the vaccine, especially if you're living in a highly prevalent COVID virus incidence. So I'm going to hold that. It feels like a rapid fire of information, but I'm sure a lot of questions may recur. So I tried to give the talk a bit quicker. And you can always go back to the slides and listen to it if it was too.
Thank you so much, Dr. Padmaja, for such great insights on this particular topic. Now we'll take some questions from our viewers. Doctor, first question coming from our viewer is who is eligible to get vaccinated? Is there anyone who should not get vaccine?
So we just spoke about children and pregnant ladies cannot have the vaccine because it's not been tested. And if you are a cancer patient, if you're having acute leukemia diagnosed today, we would not consider you for a vaccine. We want to get you out of this treatment from the induction phase and then start thinking about giving you the vaccine. So, as such, a blank statement, if you are a child, pregnant, lactating mother, you should not have it. If you are on a high dose steroids, not a low dose, 5 or 10 milligrams, if you are on 20, 40 milligrams, 60 milligrams of steroid, you should not have the vaccine. If you've had an ATG treatment recently, you should not have the vaccine. So the rest of the patients, if you are really unwell in ICU or in a hospital-based treatment, or if you are in the middle of a leukemia treatment in the hospital, that's called the induction, you should not take the vaccine at that time. But once you get over, your blood counts recover, then you can take the vaccine. There is another small thing people keep asking us. If you are on aspirin, clopidogrel, can we take the vaccine? There is no problem in taking the vaccine if you're on a blood thinner like aspirin or clopidogrel, Plavix. But you should be careful when you're on warfarin. Still, you can take it. You should apply a lot of pressure and make sure that there is no bleeding at the site. The needle we use is very small and the injection is given zero point 0.5 ml. So it is entirely safe to continue to use.
Okay. Doctor, if we talk about lymphoma patients who are on lymphocyte depleting therapies, so is COVID-19 vaccine still be effective for those patients?
So a great question. If somebody have particularly used the lymphodepleting chemos, that means you're on a quite a strong chemotherapy, maybe a salvage chemo, somebody who has had a lymphoma treatment, standard is R-CHOP, all these. Those patients can take it 2-3 weeks when the count recover. But if you're on a salvage chemotherapy, that is a second line or a third line, the blood counts would have gone down very low. So you can't take it at that time. You have to wait for your blood counts to recover. But if your lymphocyte count is very low, you may not mount a response. But if your rest of the counts are good, neutrophils are good, platelets are good, and you don't have a transplant lined up within 2-3 weeks, I would suggest that you should take the vaccine. Yes, some response is better than none. That's the norm.
Doctor, talking about patients who are diagnosed newly with blood cancer. Is this COVID-19 vaccine should be taken before blood cancer treatment, and how effective this can be for these patients?
A great question, whoever has questioned it. I don't know what leukemia they're having. So suppose if you were diagnosed with acute myeloid or acute lymphoid leukemia, like acute blood cancer. So at that time, to start with, they would have a very low blood counts, a very low platelets, very low white cells. That itself is a contraindication. We are telling you platelet should be more than 50,000 and your neutrophil should be more than 1,000. That's the time to take. And these patients are very unwell. So when they're in the first treatment for acute leukemia, as an inpatient, you cannot have the vaccine. But once you get out of that, you finish 1 month treatment, you can consider taking it. But if you are a patient who is newly diagnosed with CML, still there is a time after about a month, 4 weeks time when your treatment is settled, your blood counts are settled a little bit, you can consider taking it. So that we have to find out what time period to take, what are the blood counts at that time, how unwell they are. If they're well, blood counts are relatively stable, they should consider taking it in the next month or so.
Doctor, we have talked about blood cancer and lymphoma patients right now. The next question which we are getting from our viewer is when should a transplant recipient or a candidate receive these vaccines?
It is a 6 months post-transplant when you start to thinking about considering the patient for a vaccine. And this is not a live vaccine. Anybody after the transplant should not receive a live vaccine, but it is a killed vaccine. So it is relatively safe. What we need to ensure is that they're not on a high dose steroid and their blood counts are good because post transplant sometimes we have complications and still patients have got slightly low blood counts. But as long as your blood counts are good, you're not on a high dose steroid, you're well out of the transplant into 6 months, that is the time to consider. And if you've got other vaccines scheduled, we can delay those vaccines about a month and take these 2 doses of the vaccine and then go on to the next. So 6 months is the time when to start.
Okay. So, doctor, talking about the precautions and the general public health guidelines, uh, what will you suggest for bone marrow transplant patients and leukemia patients? Like, what are the precautions they should take with
Yeah.
this vaccine?
So a lot of patients, if you ask me this question, I have to revert back to the current situation, what has happened during the first wave, March, April, May. A very few patients of me who had acute leukemia and transplant have contracted a COVID virus because they're already taking all these measures, what we talked about. Because the moment you have a leukemia or transplant patient comes in, we're talking about how to prevent infections, mainly fungal infections. So they're most of the time wearing their masks, they're using all the cleanliness. So it's a very few patients who have had a COVID infection because they're taking all these general measures already to prevent infections, and their food has been looked after to prevent infections. So they are not the risk. The risky people are the ones who have finished their treatment. They have released their all these safety measures. They are the ones who had the COVID infection. So they have to continue to follow all these measures what we've discussed earlier.
So, doctor, another question we have from our viewer is if a patient is on radio treatment therapy, so is it advisable for that patient to still take COVID-19 vaccine?
So a great question. We have not touched on that. Radiotherapy generally is given over 20 days or 30 days sessions. While you're on radiotherapy, we would not consider we should not take the vaccine. But if you are like an area where you're taking the radiation is very important. If you're taking the radiation to the pelvic area, pelvic bone, your blood counts will go down very quickly. Or if you're taking the radiation in the area of the spleen, the blood counts will go down very quickly. So one has to consider the blood counts are good and you are off your radiation therapy, but you finish the 20 sessions or 30 sessions, what is planned, and then ensure your blood counts are normal. If you're taking the radiation to your facial area or hand or somewhere, it does not the counts. Once you finish the sessions of your radiation, you go for a vaccine. But if you are a person who is receiving radiation to the hip area or in a pelvic area, or a splenic area, one has to be careful that you check your blood counts. You have to recover your blood counts and then take the vaccine. And follow that guidelines that you should have your neutrophils more than 1,000, absolute neutrophil count more than 1,000, and platelets more than 50,000, and then plan for.
So, doctor, if you talk about cancer patients again, so what are the what is the dosage which is recommended for these patients of COVID-19 vaccine?
So there is no difference in the dosage. It's exactly the standard dose what we give it for the general population. It is zero point 0.5 ml vaccine is given into your deltoid, into your arm. So it doesn't matter which side you take. You have to take it into your muscle, intramuscular area. So there is no difference, and the number of doses are the same. There are 2 doses. Just because you may mount a less response, currently there is no recommendation to give a third dose. There are some talks in some institutions in America about should we consider them for a third dose because they've tested the antibodies. Antibodies are not very good. But that's not very much proven. But people think logically it makes sense, but it's not an established practice yet. As the time goes, I think we would know more information about it. But currently it's 2 doses into the muscle.
So another question we have from a viewer, doctor, that can patients with cancer on clinical trials can receive this COVID-19 vaccine?
So while you're on the clinical trial, there may be restrictions. We have to check with that clinical trials team that they would be allowed. Because once you're on the clinical trial, a lot of interventions, what we do are counted into the activity. So if you're off the treatment, you're only on the monitoring phase of clinical trial, I think they would allow you. But if you're on active chemotherapy, there would be restrictions, and we have to check with that particular clinical trial. In Western countries, people are on clinical trial are incorporated into the timescales when they can have the COVID vaccine. So that part is also streamlined into those people. So there is a little bit of a gray area there. We have to check with the trial. Otherwise, you may disqualify for the trial and come out of it. So we have to be careful.
So, doctor, if a patient is already on medications like ecosprin, warfarin, clopidogrel, so can these kind of patients take COVID-19 vaccine?
So it's not about a COVID-19 vaccine. It's about you're giving an injection into the muscle. And we say anybody with a very low platelets, you should avoid intramuscular injection. That's a very standard thing we tell. So first thing, if you're on ecosprin, clopidogrel, there is no problem. You can go ahead and take your vaccine. But if you're on warfarin, if your INR is more than 2, you have to be careful. So you probably have to stop the warfarin, bridge it with some dose of clexane, and then reduce your INR below 2 before you take the vaccine. We don't want to give a vaccine to somebody who are running warfarin dosing, INR about 4, then you develop a huge hematoma in the muscle. So if your INR is very high, you have to stop the warfarin, give some medicine to bridge that period, and then take the vaccine when your INR is a warfarin measure is lower than 2. If your platelets are very low, that is less than 50,000, you have to check with your doctor, take some treatment to lift up your platelets, and then take the vaccine. The platelets very low, less than 50, you have to be careful. Warfarin, you have to be careful. But your hemophilia patient, you have to be careful. Genetically, some people have got a bleeding tendencies. They all have to be careful about taking the intramuscular injection.
So, doctor, last question for this session. Is there any healthy diet or healthy food you would recommend along with this COVID-19 vaccine for leukemia and blood transplant patients?
So no session will end without asking a dietary question. So there's a lot of talk about immune boosters, or traditional things about turmeric and so many others. All these might help, but we don't have much of evidence. It may be indirectly proving that patients have got a lesser severity of COVID infection. Maybe that we have been consuming all these things quite regularly. We talk about high vitamin C content will prevent, and which we have used in the trials for COVID treatment, which is there in lemon. A lot of people are using lemon and honey in the morning. That has become a good practice for many people, which is a good thing to do. Using turmeric, we know that it's got some effects. It is a good thing. Using ginger is a good thing. So these common traditional things what we use in our day-to-day life as part of our, whatever our upbringing and religion, it's doing some good. So I would not say not to go for it. But if you ask us the evidence, we're never going to find the definitive evidence. There is an indirect evidence. So stay healthy, take good, healthy diet. Just by eating vegetables, it's not going to improve your immune system in one day. Doing yoga, feeling better, feeling stronger, using the good healthy food, home food is definitely going to help improve the self confidence, thereby improving the immune system.
Thank you so much, Dr. Padmaja, for your time this evening. We hope our viewers could get help from your informative views. This was a very enlightening session. To our viewers, please reach out to your nearest specialist doctors to get a personalized consultation on your health. Librate is also here to convey true and authentic information during this COVID era. This marks the end of this current session. We will be back with more information in the next session. Till then, stay tuned. Thank you so much, Dr. Padmaja.